So we're now recording. We are talking today about government benefits. These are government benefits as they apply to older folks in particular. I do this for a lot of reasons. Some of it is very basic. Many of you are probably already on Medicare, for example. So bear with me. I'll get into a little bit more complicated things as I go forward. For those of you that have never been to one of my presentations at the Senior Center or the Center at Belvedere, I always provide a handout when I do these in person. And unfortunately, because we're not in person, I can't provide you with a handout in advance. But if you will email me, my email address is up on the screen. If you want to take that down, I'll put it up again at the end of the presentation. So if you want to get a copy of the handout so that you can refer to that later, I'll be happy to email it to you. All right. So let me just introduce myself while my details are up there, give you an opportunity to jot that down. It's as close to a commercial as I'll get. I am Doris Geldman. I am an attorney. I am not the kind of attorney that does car accidents or divorces or any of those kinds of things. I exclusively practice elder law. I know many of you already know me, but you may not know very much about elder law. It incorporates a lot of things, including wills, trusts, guardianships, conservatorships, powers of attorney, lots of things like that. If it has to do with older folks, I probably know something about it. And if I don't know something about it, I'll make it up. Just kidding. What I'll actually do is do some research and figure it out. So we're going to move on and into the presentation. Today, as I said, I'm talking about government benefits, and I'm specifically addressing government benefits. Hang on a second. I'll just shut my door. Specifically addressing government benefits for people over 65. And what do I mean by that? And why is that important for people who are over 65? For most of you, I'm not yet 65, but I will be soon, our wealth accumulation period of our time, and if you ever had a financial advisor, they talk about wealth accumulation phase. For most of us at this age, it's beginning to wind down, right? We've either retired or semi-retired or thinking about retiring. So our income is going to be fixed, if not less than it was. And we're looking for ways to make our savings last, presuming that we have some, or to preserve our assets, things like our house and our retirement accounts and investment accounts and things like that. And because your income is fixed and sometimes limited, digging into our savings is something that's almost unavoidable. So we're going to try to reduce the rate at which we chew up our savings. And one of the ways to do that is through government benefits. And some of these things you paid for during your working life, and you might as well get them, right? This is not charity or welfare or anything.
Elderly law.
Can you please?
It's an elder law presentation by a lady in Charlottesville.
Sorry, please make sure your audio is muted so that you don't turn up on the recording of this. So why do we need to be concerned about these benefits at all? We are living much longer. As you probably all know, I've actually lived longer than I ever expected to live. But there were actuarial tables that were done in the 1940s and again in the 1970s that showed that we are in fact living longer than we ever expected to live, and hence our money needs to last longer than we ever planned on doing. The reason we live longer, or part of the reason we live longer, is we're getting much better medical care. We are also taking better care of our health, or most of us are. Better diets, more exercise, less booze and cigarettes, all those kinds of things mean we are going to live longer. But we are, no matter what, going to as we get older, we're going to require more medical care. We will get increasingly frail. And so those expenses are almost always going to increase unless, as I hope will happen to me, I'll just be hit by lightning on the golf course, and that will be that, and won't need to worry about those things. But the chances of that happening are pretty slim. One of the ways that we can stretch out our savings is to tap into those benefits that are available through the government, or at least today they're still available. Don't know what's going to happen in the future. Don't have a crystal ball about that. One thing I do know and do have a crystal ball about is that our costs, particularly our medical costs, will continue to rise. So, with all of that in mind, where is this money going to come from? The government benefits that I'm talking about in particular, some of them are guaranteed trust funds. You're familiar with these. You paid for them. Social Security and Medicare are in a trust fund, and theoretically, those are guaranteed for those of us that have contributed to them. There are other benefits, things like Medicaid, SNAP, which is what we now call food stamps. Those are in something called a general fund. They're basically for people who have a financial need for assistance, either temporary or permanent. And those are provided through the general fund. And you paid for those too. You pay for them through your tax dollars. And then there are people who have benefits by virtue of having either served in the military or worked for the civil service. Railroad workers also have particular benefits that are paid for them. Those I refer to as service-related government benefits. I want to start out talking about Medicare. I want to tell you that I am not going to talk about Social Security specifically. Social Security is a world unto itself, whether retirement or disability. I could talk for days about Social Security alone. I'll probably have another panel. I'm actually going to do a panel later this year, and I'll bring someone in that knows a lot more about Social Security than I do. But I do want to talk about Medicare today. And the basic thing you need to know is that it's health insurance. It is not long-term care insurance, and I'll talk about that more in a little bit. And you automatically are entitled to Medicare if you paid into it when you turn 65. It is health insurance. As I said, most of us pay for it while we're working. So if you're still getting a paycheck, on your paycheck, looking at those deductions that are made for your income taxes, the one that says FICA, that's the one that goes into the Social Security and Medicare Trust Fund. So you've been paying for that all along. And you become eligible when you turn 65 to start collecting on that. I cannot wait. I hope Medicare is still going strong when I turn 65, because I could really use it. Anybody that's paying for health insurance right now that is not Medicare, you know why that is. If you are not yet 65 and you're going to be turning 65, not too distant future, you need to know that you need to apply for Medicare 3 months before your 65th birthday. If you do not apply on time, there are penalties for applying late. So you need to make sure you do that on time. And you can do it online, by the way. So Medicare, my guess is that most of you have seen a zillion ads about Medicare and how to save money and how you reduce your costs and all those other things. And I'll talk a little bit about that, but I'm going to start out by talking about what's called traditional Medicare. This is the government provided Medicare that most of us got when we turned 65. And it's broken down into several parts. Part A is hospitalization and major medical. And most of us got this when we turned 65. You paid for it. This is what you get from your FICA deductions. Part B are your doctor's visits, other costs, things like labs, x-rays, all of those sort of diagnostic things that are not included in hospitalization and major medical. And Part B is something that you pay a premium for, and it's often directly deducted from your Social Security check. So at the beginning of the year, you get a form that says, this is your Social Security benefit for the year. This is how much you're going to get every month. This is how much we're going to deduct from Medicare. And what they're referring to is your Part B Medicare. And they take that directly out of your Social Security. So I am not an insurance advisor. I cannot sell Medicare plans. I know a lot of people that do, and I know enough about them to be dangerous. But when you see those ads on TV and they talk about you're going to save, $184 is going to be put back in your pocket, what they're talking about when you buy an Advantage plan, this Part B is going to go away, and it will no longer be deducted from your Social Security. So it seems like you're getting money put back in your pocket. What they don't tell you is that you're going to pay a premium for the Advantage plan that replaces it. We'll talk about that a little bit more in a minute. Part C is Medicare Advantage plans. These are sold by insured companies. You might have one that's provided by Anthem, Blue Cross Blue Shield, or Kaiser Permanente, or AARP, one of those people. They are private companies providing Medicare coverage, and it's called Medicare Advantage plans. Part D is your pharmacy benefit. If you have Part C or you have an Advantage plan, you are not paying separately for all these different parts. So keep that in mind as we go forward. If you have traditional Medicare, you may also buy privately through a private insurer a supplemental plan, which is called Medicare Supplement or Medigap. And those are private insurance that cover some of those costs that Medicare does not. For those of you that are using Medicare or traditional Medicare in particular, you probably know that Medicare does not cover certain things, and there are also copays and in some cases deductibles. And the supplemental plan will cover those copays, deductibles, things that Medicare does not cover. But you do pay for the supplemental plan privately. You do not have to have a supplemental plan, but for some people it makes sense because there's a lot of additional costs that Medicare does not cover. Again, if you have an Advantage plan, you probably have them instead of Parts A, B, D, and all those sorts of things. You do not need a supplemental plan if you have an Advantage plan, but the coverages are very different. So you do want to talk to a qualified insurance advisor about those things. There are some people who are not insurance salespeople or agents who can give you much better information about available plans and what it costs and what you can save one way or the other. So do seek out a qualified Medicare advisor. If you don't want to talk to an insurance person, you can email me. I can give you the name of a couple of people who provide counseling for Medicare. One of the things I'm acutely aware of is that people are often shopping for a lower premium, trying to keep their expenses down, but they don't realize until they get into it that that may mean that their actual expenses are higher because the coverage is not as good. And particularly in our area, Albemarle County has the single worst insurance coverage in the country. And that's true if you are under 65, whether you're buying insurance through the marketplace or Obamacare, as it's sometimes called. And that's true if you're buying an Advantage plan. They tend to be more expensive than anywhere else in the country in Albemarle County. So when you're shopping for a lower premium, make sure that you understand that you may not get as good a coverage as a result of that, or you may have a higher deductible. And one good way to really look at that carefully for people who are in pretty good health and don't need a lot of health care, a lower premium Advantage plan may be a very good plan for you. But if you're older or very frail or have a lot of medical expenses, a lower premium may mean that you have a lot more out-of-pocket expenses because you need a lot more care that does not get covered by the lower cost insurance plan that you get. So I'm still talking about Medicare, and I can't emphasize this enough. I am amazed at how many people do not realize that Medicare does not cover long-term care costs. What do I mean by long-term care? Nursing home care, assisted living care, care in your home. It does not cover long-term care costs. It does cover skilled nursing or rehabilitation after you've been in the hospital for 3 days. I should say 3 nights. 3 24-hour periods in the hospital. It will cover skilled nursing. That's physical therapy, occupational therapy, wound care, speech rehab, all of those sort of things. And it will pay for it only for a period of time. It will pay for the first 20 days, 100%. Medicare will pay for that. After 20 days, on day 21, you're going to pay, and this is the 2021 copay, is $185.50 every day. You can check into the Hilton for less than that, but that's the copay that you will pay starting on day 21. What typically happens is when somebody is in nursing or rehab, on about day 18 or 19, the nursing home is going to start making noises about discharging you. And that is because your Medicare 100% benefit is about to expire. They know that. They know that most people cannot afford $185.50 a day to continue to get rehab. So they're going to start making noises about discharging you. That does not mean discharging you from the building. It means discharging you from skilled care. You may still stay in the nursing home, but you're going to be paying privately for the whole amount of the nursing home stay, which is about $7,000 a month. So that's what that means. They are not going to put you in a wheelchair and put you on the curb unless it's appropriate. If it's safe for you to do that, they may do that. After day 100, you're paying for everything. You're paying the full freight. Skilled care, I can't remember what the exact daily rate is, but last time I did this, it was about $7,400 a month if you're privately paying out of pocket for that. If you have a supplemental Medicare, or what's sometimes called a Medigap policy, it's going to pay the copay, the $185.50 a day. That is why the nursing home really wants to know what kind of insurance coverage you have, because they know they're going to continue to get paid the full freight for longer than those 20 days. So just to quickly sort of make this very clear, I know a lot of you have more than one Medicare card. If you have traditional Medicare, you have a card that looks something like this in your wallet. And I'll point out that it does no longer have your Social Security number on it. It has some other number on it. It used to be that they printed your Social Security number on it, but the card still looks like that. Notice on this one, it's got the hospital coverage, Part A, and medical coverage, Part B. Not everybody has that. Some people do not have Part B on their Medicare card. On the other hand, if you have an Advantage Medicare plan, you're going to have a card that looks something like one of these. Quite a few of you probably have an Anthem Blue Cross Blue Shield card that looks something like this. And that's what you have if you have an Advantage plan. If you have a Medigap plan, you're also going to have a card that looks like this for the Medigap or supplemental plan. And you're going to have the traditional Medicare card. So you'll have two cards in your wallet, one that looks like this and one that looks something like one of these. And you very likely also have one of those cards for your Part D. So you may have as many as 3 Medicare cards in your wallet one of which is for traditional Medicare, one of which is for your supplemental plan, and one of which is for your Part D pharmacy card. So some of you I know are young enough to be listening to this presentation because you're dealing with your parents. So if you're confused about what kind of Medicare coverage they have, that's maybe why they have so many cards in their wallet, is because they're carrying all 3 of those plans. If you are dealing with a pharmacy benefit, some of you may have heard about this thing called a donut hole in the pharmacy coverage. It's not nearly as bad as it used to be, but I'll explain it anyway. So at the beginning of the year, when you start your year, your coverage for pharmacy starts on January 1st, and you have full coverage, whatever that plan covers. Many of them have different formularies, so I can't say exactly what your plan covers, but it begins January 1st, and you make your claims for every pharmacy drug that you buy, and either the plan pays or you pay a copay and they pay or whatever it is. And then at a certain point, when you have paid and the plan has paid a certain amount of money, you fall into what's called the donut hole or the coverage gap. And during that time, Medicare Part D does not pay for your pharmacy expenses. And then once you get through that donut hole, you reach another point dollar-wise that you've paid for your pharmacy, and coverage will kick back in, and that's called catastrophic coverage, and it will pay for the rest of the year. For some people who don't use a lot of medications, you may never fall into that coverage gap. And here's the actual numbers as I have them for 2021. The coverage gap starts when you and Medicare have spent $4,130 on medications. So if you don't take a lot of medications, you may never fall into that coverage gap. Many of us do. For those of us that have chronic conditions like diabetes or some other illness or chronic condition that you take a lot of drugs for, you're going to hit that $4,130 in no time. And then you fall into that coverage gap. You're in the donut hole. And while you're there, Medicare will continue now to pay 75% of a generic drug, and you pay 25% of that. So it's not nearly as bad as it used to be. It used to be that Medicare paid nothing while you were in the coverage gap. Now they do. Name brand drugs, if you have to have a name brand drug, those are on some kind of discount schedule. Every plan is different. I can't speak to how much they pay or how much they don't, but there should be a formulary that designates what that is in your plan. Once you've spent, and once Medicare has spent $6,550 this year, you're out of the coverage gap and automatically into catastrophic coverage. So once again, it's not nearly as bad as it used to be. It used to be pretty bad. I know my mother, initially the coverage gap kicked in right around $1,300, $1,200, $1,300. And she would be in that after a month or two into the year, she would be in the coverage gap. And the catastrophic coverage didn't kick in until you hit like 7,000 or something like that. It was a lot of money. So just to sum up a little bit about Medicare, you work for it, you're entitled to it, claim it. And don't forget to do it 3 months before your 65th birthday. Almost everyone gets Part A. The exception to that is going to be people who are civil servants. They have a different plan. Railroad, some people get military. If you're retired military, you might have both Medicare and one of those as well, so which is great if you have that. Again, it does not cover long-term care, and it's very complicated. I strongly suggest that you do not go this alone. There are a lot of people that can advise you about Medicare. We are still in the period where you can make changes to an Advantage plan. I can't remember which way it goes. The basic open enrollment period is from October, beginning of October to early December, but then going, I think, into March, you can make changes going back and forth to Advantage plans. If you need someone to advise you on Medicare, in our area, you can go to JABA. They have free Medicare counseling. They have free insurance counseling, healthcare insurance. You can call them and make an appointment. They will help you out for free. There are some other people who I know who are professionals that have a great deal more information about Medicare, who are not insurance salespeople, and they can give you advice that is not biased towards one plan or another because they make a commission on it. They do typically charge by the hour for that sort of advice, but it may be well worth your while to do that. All right. So that is Medicare. I'm going to move on and talk a little bit about Medicaid. Let me just say again, for those of you that joined us late, if you have questions while I'm talking, down at the bottom, there is a chat. If you click on the chat, it will allow you to type in your questions when I get to the end. I'll turn the audio back on for everybody, and we can address some of the questions when we get to the end. All right, so Medicaid is different from Medicare. It is public assistance, and it is for low-income individuals. If you have money and assets, you are not going to be eligible for Medicaid. You did pay for Medicaid through your tax dollars. It's just like any other kind of welfare. You don't get it until you're poor enough to be eligible for it. It covers children. It covers low-income children. It covers pregnant women. It covers people who are old, blind, or disabled. And it covers now in Virginia, it covers adults, low-income adults, for healthcare purposes. And it's interesting, expanded Medicare only looks at your income. It does not look at your assets. You can have significant assets, but very low income, and you may qualify for expanded Medicaid in Virginia. But it doesn't have to do with older people. When you turn 65, it reverts to the aged part. And it is Medicaid that covers long-term care if you qualify. And that is part of the aged, blind, or disabled benefit of Medicaid. Long-term care in this case refers to nursing home care. So what am I talking about? Most Medicaid in the state of Virginia is provided for nursing home residents. The big bulk of our Medicaid budget goes to nursing home residents. Medicaid does not, generally speaking, provide assistance for assisted living. It is not a medical facility. It does not pay for it. There are some very, very limited benefits provided through something called auxiliary grants for Medicaid. It's a different subject. Almost no one I know qualifies for that. You have to be very, very dire straits for that to pay for your assisted living. You may qualify for assistance in your home through something called a Medicaid waiver. Medicaid waivers, you may want to ask your provider, the person that comes to your home to care for you, about coverage through Medicaid, called the HBCS, that's Home-Based Care Services, or ECDC Medicaid waivers. I think they actually have a new name for this. I haven't kept up with it. But if you have a provider providing care in your home, you may want to ask about that. It is specific agencies, and the amount of hours that you can get is designated by Medicaid through the Department of Medicaid, or I'm sorry, Department of Medical Assistance Services, or DMAS as we call it. Medicaid, the eligibility rules are complex. They change all the time. Every time I do an evaluation for Medicaid, I have to go back and look at the new manuals and new rules because they change all the time. Neither I nor any other attorney or financial advisor is going to be able to tell you if you're going to be eligible. The only person that decides that is the state's eligibility workers at DSS. Many of us know the rules pretty well, so we can project what we think based on what your income and your assets are, whether you're going to be eligible for that. Let me just go back. All right. A lot of people will try to make themselves eligible for Medicaid, and that doesn't generally work very well. It is not easy. I have seen people create very serious problems for themselves, and I'll show you an example of that when we get a little further into this. Most people try to do it by giving away assets on paper or creating trusts. It is sometimes possible to do that, but it is extremely complicated. I would not try to do it on your own. So what do you have to do to be eligible for Medicaid? Well, for single people, this is unmarried people, people who are on their own, the financial limits are these. You cannot have more than $2,000 in what Medicaid calls countable assets. That's bank accounts, real estate, investment accounts, any of those things. Can't have a car. They assume that you're not driving if you're in need of Medicaid. So what doesn't count? Your personal property does not count. Your furniture, your jewelry, artwork, fishing rods, they don't count that stuff. They count pretty much everything else. No more than $2,000. You cannot have income greater than $2,382 a month. That is 300% of what you can get through Social Security. And that particular figure is from last year. I haven't gotten an updated figure from that. If you have more than that, either in assets or income, Medicaid may say, okay, well, when you spend this much of your income or this much of your assets down, you may become eligible for Medicaid. And this is particularly important when it comes to income. So if you make, if I go back to that line above that, if you make $2,500 every month, you are over that amount. They'll say, okay, the first 200 some odd dollars you're going to pay. And then when you hit 2,382, Medicaid will start paying. With assets, they're going to ask you to spend all of your money till you get to that $2,000 point, and then you'll become eligible. It's a spend down is a little bit like an insurance deductible. You spend this much, and then your coverage kicks in. That's what they mean when they talk about a spend down. Fortunately, for married people, spouses, Medicaid thinks of that very differently. It's a very bad public policy to expect to impoverish two people in a marriage if only one of them needs care. So they divide married couples into the nursing home spouse and the community spouse. That is the person who remains outside of nursing care. And the person that goes into care, that goes into the nursing home, they get from their Social Security or whatever their income is, they get $40 a month. I know it's criminally low. I spend more than that on coffee every week. But that's what you get, 40 bucks. Keeping in mind that all of your other expenses are paid for. All of your meals are paid for, your heat, your healthcare, all of that is paid for. So it's not as unreasonable as it sounds. You can also keep any amount of your income that pays for health insurance or anything that Medicaid does not otherwise pay for. Some of those things are glasses, for example. Medicaid does not pay for glasses, but they will allow you to pay for glasses and deduct that from what goes to the nursing home. It's kind of a complicated situation, but there are many occasions where that's the case. If you and your spouse own a home, that home is not counted for the nursing home spouse. the spouse gets to keep it and continue to live in it. The income that belongs to the nursing home spouse goes to the nursing home unless it would deprive the community spouse of a quality of living that they're accustomed to. And it's a very, very careful calculation, and it's complicated. I have the formulas that calculate that, so I can tell you more or less what the community spouse is going to get. And what that's called, the federal law describes that as a minimum maintenance needs allowance, or MMNA, and it is 150% of the federal poverty level. So the income that the community spouse gets that has their name on the check, your pension, your Social Security, and any other income that comes in with your name on the check, you get to keep. So that's income. Any joint income, in other words, if you and your spouse have rental income from some property, you get to keep half of that. You also get to keep, if all of that income does not add up to the 150% of federal poverty level, they may redirect some of your spouse's income back to you to get you to that minimum monthly maintenance needs allowance. Oops, there's a number under there. Right now in 2021, the minimum monthly maintenance needs base figure is $3,259.50. So we will get you to that if you have enough income to make that up. We will try to get that back in the community spouse's pocket. So not as bad as it might sound otherwise. So that all of that I was talking about has to do with your income. Medicaid also looks at your assets. They call them resources. Everyone else thinks of them as assets. Nothing changes for the nursing home spouse. They really don't get to keep much, $2,000, as we discussed before. The community spouse gets to keep, they don't get to keep among your countable assets. And you have to keep in mind that when they're talking about countable assets for a married couple, they are talking about all of your household assets. So that's you and your spouse together. It does not matter if it's your IRA or their IRA. It is a household countable assets. They don't care that there's a tax penalty. They don't care that, there's generally a penalty and the taxes that have to be paid on that sort of stuff. It's available to you, but you get to keep half of the household assets. This is this year's number, up to $130,380. Doesn't sound like a lot, but you also get to keep your house. So it's $130,000 and your house and a car. And that car can be a brand new Rolls Royce. It doesn't matter what kind of car it is. It can be any kind of car you want. And what I typically recommend to people is that you buy a newer, more reliable car if you don't have one. You might as well use up the money that you can't keep by not having to buy a car in 3 years. There are other things, and just as an example, there's something called a funeral director's irrevocable trust. Why not pay for your burial expenses and not have that count against you? There are certain types of savings bonds that you can buy that are not countable by Medicaid when they do this evaluation. There are certain types of annuities, very specific types of annuities. Don't go out and buy just any. But annuities will pay you income. So you're putting money away. It's not going to get counted by Medicaid, but it's now going to pay you income. So make sure you don't knock yourself out of eligibility because your income is too high. So again, on Medicaid, be very, very careful about trying to transfer this stuff around. If you try to give things away or put them in a trust, you can bring on yourself some penalties, and they can go back. When you make this application, they're going to ask you about financial changes that you made in the last 5 years. It can be like an IRS audit. They're going to want to look at your bank statements. They're going to want to make sure you didn't transfer your house, all those things. If you have, they call that an uncompensated transfer. And an example is somebody that gave his house to his son or transferred it into a trust. If you do that in the last 5 years before you make the application, they're going to penalize you beginning at the date of the application, not the date you made the transfer, but the date that you made the application. Usually it helps if I give people a little example. It's based on the amount that you transferred. So if you have a house that's worth $300,000 and you give it to your son or to a trust and you didn't get paid for it, you didn't get $300,000 for that house, 2 years later, you apply for Medicaid and they discover that you made that $300,000 gift. They take that money that you gave away or the value of the house and they divide it by what they value the cost of nursing home care, which currently is $6,422 a month. $300,000 divided by $6,422 results in a penalty of 47 months for which you will not be eligible for Medicaid. 47 months is almost 4 years. Now, how are you going to pay for your care? You gave away the house or whatever else it was. Somebody's got to pay for your care during that time. So keep that in mind if you're trying to Medicaid plan. There's lots of people around who are trying to do Medicaid planning or asset protection trusts. It is not simple. It is not a national plan for long-term care. That is not what Medicaid is. It's for poor people. Very, very complicated rules. I know most of them, but even I have to go back every time I do this analysis and look at the new rules that change almost every day. And really the most important thing to know is that you may very likely get penalized and delay your eligibility actually when you need it most, which is going to be very, very unfortunate. All right, I'm going to switch gears here and I am going to talk about veterans benefits, but I'm going to put you guys on hold for just a moment and I'm going to turn off recording if I can remember how. All right, so we're talking about veterans benefits now, and I know not all of you are veterans, but most of you know veterans, so you might want to listen in just so that you can talk to them about this and maybe point them in a direction that's helpful for them, or you can always send them to me and I can talk to them. So when we're talking, Veterans Administration provides lots and lots of benefits, and these are those benefits that I talked about that you get by virtue of the fact that you served. These are not paid for out of our tax dollars. They are paid for from our tax dollars, but they are not. You don't pay into them in order to claim them. In other words, this is not an entitlement program. Social Security and Medicare are entitlement programs. You're entitled to them because you paid for them. In case of veterans benefits, you're entitled to them because you served. Healthcare benefits, in my opinion, all veterans should seek qualification for healthcare benefits. You can get lots and lots of things. You can get medications a lot cheaper through the Veterans Administration if you qualify. In any event, even if they have Medicare Part D benefits, you can get, once you've spent $700 on your medications, you can get the rest of your medications through the Veterans Administration free or at very low cost. Worth checking into. If you don't know, there is what's called a community-based outpatient clinic right here in Charlottesville. It's over on Pantops near Martha Jefferson Hospital. They provide all kinds of outpatient care, including nursing services, home care, all kinds of great stuff. There's a major medical center in Richmond, McGuire Woods, And it's a huge medical complex. They provide everything. There is also a community-based outpatient clinic in Stanton, and a major medical center in Salem. My dad was treated many, many, many times over in Salem, and they provided great care for him. Nothing but good things to say about those guys. There are 2 long-term care facilities that are actually operated by Virginia's Department of Veterans Services. There's one in Richmond and one in Roanoke. I've never been to them, but I understand they're actually very nice. But you do have to be a veteran in order to be eligible for that. And spouses are not eligible for long-term care there. So like everything else I've talked about, these things can be extraordinarily complex. One of the things I caution people about, if you're looking for assistance with long-term care of any kind, make sure whoever you're talking to knows about both Medicaid and Veterans Administration's benefits, because you may end up doing something to qualify for one which will disqualify you from the other. And you want to analyze both and make sure that you're doing the right thing in order to qualify for whichever benefit, and sometimes both, is the best choice for you. And very often people will know about one or the other, but not both. You can get free help with veterans benefits from the Virginia Department of Veterans Services, which I mentioned. They're the people that run the nursing homes, the veterans nursing homes, but they have an office right here in Charlottesville that can help with all kinds of Veterans Administration benefits. And the reason, aside from being free, one of the real big benefits of working with those folks is that they have a direct connect into the Veterans Administration and can follow up on your applications directly. People like me, private advisors, don't have that. I'm just like you. I got to wait on hold 40, 50 minutes, an hour. I've waited as long as an hour and 15 minutes on hold, and then they disconnect you. But the folks over at the VDVS meet with Veterans Administration people once a week and follow up on applications. So that's a really great service, and it's free. This particular office serves all of these counties and the city of Charlottesville. There are VDVS offices all over the state. If you're not in one of these counties, you can drop me an email and I will let you know where one is near you. Veterans benefits include something called service-connected disability. What's a service-connected disability? You qualify if you have a disability that was either diagnosed, and the Veterans Administration calls that rated. You were rated with a disability at the time you served or upon your discharge, or if I can show that it was related to the period of time in which you served. In other words, if you're a Vietnam vet and we know you were exposed to Agent Orange, I can show that certain disabilities are as a result of that exposure to Agent Orange. This is not to be confused. It may be a combat injury, but it does not have to be a combat-related injury. It's any kind of illness that was diagnosed during your period of service or is traceable to your service. The best example I can think of, as many of you know, I tend to use my parents as an example. My dad had a 10% disability due to a knee injury while he was in the service. And he collected, I don't know, $60-some a month for the rest of his life from the time he was 18 or whenever it was he was discharged. He was probably 19 when he was discharged. Got that for the remainder of his life. There are things that are called presumptive service conditions, presumptive service-related disability conditions. And some of them are very unexpected. You would not expect it to be a disability related to your service. And I can't remember all of them. There's many of them. But for example, certain heart conditions are presumptively service-related conditions, depending on when you served and where you served. the list, which you can go and look at if you served and you want to know if it's something that you've got now might be a service related condition. The list is there. If you email me, I will send you this presentation and the link will be in it. Don't feel like you have to write it down. So just drop me an email and I'll send you the slides, or take a picture of the screen, whichever works best. And that's where you can find the list of presumptive disability, service-connected disabilities. What does it mean? If you have one of those disabilities, and it was rated at the time that you served, you might be re-rated if that condition got worse in the intervening years. And again, I'm going to use my dad as an example of that. Too quick. My dad also was diagnosed with a duodenal ulcer while he was in the Navy, and he was not in combat. He floated around the Mediterranean and got drunk in every port, and developed a duodenal ulcer while he was at it. And when he was discharged, he was rated with a 10% disability for the duodenal ulcer. I didn't know any of this. When he got older, I started looking for a different veterans benefit for him, which I'll talk about in a minute. And then I discovered in his medical record that he had this duodenal ulcer. The medical problems that he was having were related to his digestive tract. He had ulcerative colitis, which was very, very easy to connect to a duodenal ulcer, which I managed to do. And I was able to get him a 100% rating for his medical condition, which gave him $3,700 a month tax-free. Disability is not income. It is not taxed as income. And if you are in the Commonwealth of Virginia and you are a 100% service disabled vet, you also don't pay property taxes, nor does your spouse. The other benefit, and this is the one that I was looking for my dad, is colloquially referred to as aid and attendance. Aid and attendance is not what the benefit is called. It's called the improved pension. It is for people who do not have a service-connected disability, or if they're 65 or over. I hate to tell you, but the Veterans Administration thinks if you're over 65, you're disabled. Doesn't matter, fine with me if it means we get some money. But this is for people who, like Medicaid, financially qualify. You have to be very low income in order to qualify for this. It used to be that we, unlike Medicaid, we could do all kinds of things to get people qualified for this. I'll come back to that in a minute. But there are 3 levels of improved pension, and it depends upon what kind of help you need. If you get the basic pension, which is a certain dollar amount, it's just because you served and you don't have a lot of income. If you are housebound, what does housebound mean? Housebound is not the same as bedbound. Housebound means that you don't often go out of the house, or that you need assistance to go out of the house. But you can still be, for example, going to church and other social activities, but you're not getting up every day and going out to work, for example. But you can go and do errands, but you probably need assistance to do that. The highest level of income assistance is for aid and attendance, which is where that name comes from. But it is not actually the name of the benefit. It's the level of improved pension that one gets. One of the really important things about this is that it's also available to the spouse. And when you die, it's available to the surviving spouse. So that benefit continues. And this is not true of most veterans' benefits, although it is true of disability if their death is caused by the disability. To get the improved pension, you must have served at least 90 days on active duty. If you were a reservist and never served on active duty, you are not eligible. But you have to, if you have served 90 days on active duty, you may be eligible for this. You have to have served at least 1 day during a time of war. It's a time of war. That does not mean that you served in combat. There are specific dates and times that a war was in place. Now it's mostly Korea, some Vietnam, but it also includes Iraq if you have people who served in Iraq. And that is ongoing, that's a continuing time of war. But they are very, very specific dates. If you were a Vietnam veteran, it also means that you were in country in Vietnam during certain dates. They just recently changed this to include what's called blue water vets. Blue water vets are people, for example, who served on aircraft carriers and came into contact with things like Agent Orange through handling the munitions that were loaded onto planes. Those are blue water vets. And your discharge can be anything other than dishonorable. It does not have to be honorable. It can be a general discharge, and there are other types of discharges. I don't know what they are. As long as it's not dishonorable discharge, you should be fine. And you have to be either over 65 or disabled. It does not have to be a service-connected disability. Here's the kicker. Sorry, I got to move things around. The veteran's total net worth, your assets and annual income, cannot be more than $130,000. You are not eligible if you've got more than that. And what that means is your assets, that's your, your home and your bank accounts and all that stuff, and 1 year's worth of your income is all of that together is $130,000 or less, in which case you may be eligible. And if you are, and you're a veteran with no dependents, you may be eligible for almost $14,000 a year. If you are housebound, you might get 17, aid and attendance, 23,000. And in each of these cases, if you have a spouse or other dependents in the house, this number gets bumped up for each one of those. These change every year, these figures. If you are planning for Veterans Administration benefits, like Medicaid, the rules are complicated and they changed dramatically in 2018. And they instituted some very specific financial eligibility rules. It used to be kind of fuzzy and we could get around them in a lot of different ways. They created, similar to Medicaid, they created a 3-year look back period. They are going to look for transactions that you made that to make you look poor and eligible for Medicaid, and they are going to penalize you in much the same way that Medicaid does. It used to be that we could reduce your net worth by transferring things out, but we can do it by recurring medical expenses still. So for example, if you are in assisted living and you require medical level care, we can reduce your net worth by the cost of the assisted living. Can't do that with Medicaid. It's really complicated, but we can do it with assisted livings using Veterans Administration's benefits. So this is really, really good way to offset a lot of the cost of assisted living, which is something I have trouble getting anywhere else. It's also available for home care. Why? Mostly because it's cash. Medicaid pays to the provider. They pay the nursing home or the agency that's caring for you. Veterans Administration pays you cash. So you can use it any way you like. You can use it for the assisted living. You can use it for home care help. You can use it for groceries or your electric bill or whatever it is that you need. Big difference. So for Veterans Administration assistance, there's a lot of different things, education, home loans, all those kinds of things. I strongly recommend that everybody look into healthcare benefits if you're a veteran. You can preserve some of your cash for other uses by doing that. If you have a service-connected disability, it could be a sizable tax-free cash benefit. Do look at the presumptive disability conditions. You may have one and not even know it. The improved pension, also called the aid and attendance cash assistance, is only for very low income vets. But it's worth looking at if you fall into that category. If your only income is Social Security, you may very well qualify for that. The application for veterans benefits, if you are applying for health benefits, you can do that online. It's a really simple form. That's what it is. It's if you just Google search for the 1010 Easy Veterans Administration form, that will cover you for all of the health benefits. Disability and pension, on the other hand, are very, very complicated, lengthy applications. They require a whole bunch of supporting documentation, health records, bank statements, all kinds of things. The processing time is horrible. I've had them take more than that. When I did this presentation the first time, the longest I'd had was 14. I know I've had at least 18 months waiting for a decision on these things. This photograph, that is the Veterans Administration in Roanoke. It is a little bit better than that. They are digitizing all these records, but they lose stuff all the time. Never send anything to the Veterans Administration except by FedEx or certified mail. They always lose it. So I'm winding down here, but if you need more information, you can, of course, always contact me. But for Medicare information, this is Medicare's website. For Medicaid, Virginia Medicaid information is available there. And for veterans benefits, this is a huge website, very complicated, but it does get better all the time. There's a lot of information there. Definitely go start in these places to sort of poke around and see what you might be eligible for. Lots of information out there. I know it's very complicated. I do all of this stuff all the time. There are other people around, other advisors that also handle this stuff. If I'm not the right person, I'll be the first one to point you to somebody that can help you. So that is all I have. I'm going to put that up again. That's got my email address right there. If you want the presentation, which has all of the links in it, just email me and I'll be happy to send that to you. So you'll have a written copy of everything that I've talked about. I am going to turn the recording off